Welcome back to the Waiting Room podcast, brought to you by onlinedoctor.co.uk. Today, we're diving into the world of mental health with someone who's worked across every corner of the system, from community hospitals to international therapy and now online care. Sumiyah is a qualified mental health nurse and therapist who began her career in pharmacy, and today we will explore how therapy is changing, the growing importance of mental health in the workplace, and the common misconception that still surround getting help. Sumiyah, welcome to the podcast.
Thank you for having me.
Today our topic's all about mental health. What drew you into the work of mental health?
Honestly, it's a bit of a random one. I've not, it's been a bit of a weird journey.
I like weird journeys. Let's hear it.
I mean, if you look at my Netflix history, the documentaries that I watch, they're all very much crime-based, mental health, addiction, murder mysteries, these kind of, it was a running theme.
Okay.
But I used to work in a pharmacy and I used to come across a lot of drug addicts. I used to supervise methadone, which is an opiate substitute for heroin. And I used to just be obsessed with how these users kind of got into that way of life. And I loved it. I found it really interesting.
Did you have the opportunity to talk to some of them and to find out more about that?
Yeah, I spoke to all of them.
Okay.
And I was in that job for a long, long time. I was there for years. And I remember there was this young woman, she must have been about 28 at the time. And I was very young. I mean, I must have been about 18, if that. And we were having a conversation and she was just out with friends at a house party and started using because everybody else was, and she was peer pressured and she just fell into regularly using heroin. And she was so lovely. She was so embarrassed to come into the pharmacy every single week. And I just thought, you're just at a house party with your friends and this has happened to you. And I just find it really interesting.
I'm sure not many people would have asked that question of someone in that situation, and it must have been so nice for her to have actually someone who's interested to find out, but also for you, I presume it made you want to have the desire to figure out how to help people exactly like that.
Of course.
I remember working in Barlinnie prison.
Oh yeah, okay.
And obviously they have a really big methadone system there as well. And it was really eye-opening to see so many, it's so vast, it's so big. So obviously you are exposed to that really early on. You've obviously always had an interest. What made you, because you left pharmacy eventually, didn't you? What made you really get into the mental health field?
Honestly, I ended up just sort of researching mental health, and then, I just sort of was like, what can I study? I really enjoyed pharmacy, but not enough to become an actual pharmacist. I thought I'd like to be more client facing, not kind of behind the scenes. And I ended up studying mental health nursing.
Okay.
So that's how I just fell into it. Again, it wasn't like some long life desire to be a nurse. I just sort of fell into it, but it was the mental health side that I just loved.
And was it addiction that you really wanted to get into, or was that just the start? Then you went into general mental health with nursing? Yeah,
it was anything that's mental health related. I'm really, really interested in.
Yeah.
So not just addiction, but that was probably the driving factor.
Yeah. Okay. And so you were in the NHS at first, because you're not anymore. What's happened after that?
Yeah. So I trained and then moved to London and actually worked as a nurse in central London. Okay. So again, it was addiction that I really worked in, because the addiction side in London is huge.
Okay.
Cocaine use is, I think London is the leading city for cocaine. So it's pretty busy, but I really enjoyed it. Again, I was coming across really normal people, but they just had severe addiction. And I really enjoyed working as a nurse there. I loved it. But I kind of got to this point in my career where I thought, oh my God, is this it? And I panicked. I thought, this can't be me for the rest of my life. And then I ended up moving abroad to Dubai. So it was a big move. I left the NHS, which I love, and I love the NHS. I got a lot of stick for leaving the NHS.
I know what that's like as well. Yeah. Absolutely. So you moved to Dubai, and where's your career taking you then?
I ended up working in a hospital with for children and teenagers with mental health issues.
It's quite a change.
Huge change. It's not something that is similar to what I was used to, working with teenagers, but it was great. I loved it. Very challenging, especially being in the Middle East. Mental health is non-existent really in the Middle East.
Do you mean mental health support or mental health seeking? Mental health support seeking, is that non-existent? Or
all of it.
Do you mean that people do not have mental health problems in Dubai?
Due to the culture, it's very stigmatised, very taboo. It's not something that you would generally speak about.
But they probably is still there.
Oh,
it's
yeah.
Just not spoken about it. Okay, so do you face any challenges of how to allow people to feel safe to approach you for support?
Yeah, I mean, even when I was working in the hospital, we had, teenagers coming in and they should have been in months ago, or, they should have been seeking treatment over a couple of years. But because of the culture and the taboo, it was preventing people from seeking support. So then that it would have a detriment to their mental health. And it was really difficult.
And are you still working in that area?
I'm not working in a hospital anymore in Dubai. I now do full-time therapy online with Online Doctor.
Yep.
And the change that kind of made me transition was the fact that, working in the system in mental health in Dubai was just really difficult.
It must have affected your mental health as well.
Yeah,
yes.
It was hard work.
Yeah.
Long hours. There's no flexible working in the healthcare system. I was working like 60-hour weeks. Wow. And when you work in a system that doesn't really believe in mental health, it was difficult.
Yeah, it must be feeling like
you're
going up against brick wall after brick wall while you're doing it, and also not having maybe the support to give to those patients that you feel like you want to give it to them as well. So what does work look like now?
So now I do full-time therapy, which is online.
Okay.
I work with people all over, so internationally. So I do have clients in the UK and in Dubai, and I see them through video call.
Okay.
And we provide therapy.
And that's through onlinedoctor.co.uk.
Yeah.
Yeah. And how long have you been doing that for?
I've been doing that, I'm edging on 6 months now.
Yeah.
It's great. The freedom is unbelievable.
Yeah.
And it's just so much more relaxed.
So going back a bit, you've obviously faced a lot of challenges. Firstly, obviously working in pharmacy, dealing with patients who have addiction and seeing them day to day, and then working within addiction as well.
Yeah.
And then obviously working with a completely different healthcare system and culture in Dubai. Along that journey, do you feel any of those stages have helped you with how you approach mental health now?
I think everything intertwines really. Like all of your experience really is just useful in providing care and support. Working in a completely different healthcare system is really, really challenging. One of the biggest challenges was that myself and my colleagues, we'd all have different backgrounds, like different training. So
never even would have thought of that, of course.
Yeah. And we didn't have standards that we followed. So there wasn't a standardized protocol or procedure for things. We would kind of just do what we were used to based on our experience.
And is that just within mental health itself because it was probably less funded or less recognised, or is that across the board in healthcare in Dubai?
I'd say it's across the board, yeah. And I think it was just so challenging to be like, this is what we should do, this is how we should assess, this is how we should treat. But somebody from a different background, different educational background was coming in with a different perspective, and it was just became quite messy.
Yeah. So can you describe any of the other challenges that you faced along your journey that maybe you've been able to use those tools now that you're working in online?
I mean, there's obviously a language barrier. So the spoken language is Arabic. I cannot speak Arabic, but I was using Google Translate quite often.
To do mental health, to talk through mental health problems, you're using Google Translate.
Yeah.
That must have been a real challenge.
Yeah, it was. And a bit of charades in between.
Wow.
Some of the sort of local children that were coming in that only spoke Arabic, it was obviously quite challenging. But I started to pick up some key phrases. But even now, online, I do have some Arabic patients. But they do speak English, but I do throw in a couple of words that I know just so it makes it,
feel comfortable.
Yeah, make them feel comfortable.
Well, that is an interesting thing. Obviously, everything you've been doing up until working online has been forward-facing and face-to-face. So how do you take the transition to working on an online platform for your work? How do you build rapport with your patients and help them feel safe?
That's a good question, because I've been working throughout the NHS for the bulk of my career. I worked throughout COVID. Everything was fast-paced, challenging. It was a wild, wild ride. And now I am online. Yeah. I'm not based in a clinical setting, so it is completely different. But the key is really just to be present with all of my clients, make sure that they feel safe, they feel heard, they feel comfortable. And I no pressure to commit to sessions, no pressure to engage if you don't want to. That is key for me. And I think I always say it's trial and error to find a therapist. Do not commit to me just now. Go away, try a few different therapists, speak to whoever you need to, and then come back to me.
And obviously being online is quite a new thing these days.
Yeah.
What type of people are you finding are coming to seeking you out as an online therapist, as opposed to, say, someone local to them who they could see face to face? Why do you think patients are starting to choose online therapy?
Honestly, I think, so I've had a lot of feedback, and the main running theme is the fact that they're in their house. They're comfortable, they're in their safe space, they can have a cup of tea, they can be in their pajamas, and they can have therapy in a setting that's comfortable for them. Yep. They're not sitting in a clinic, in a waiting room with...
Yeah, that should make you uncomfortable.
Yeah.
Your heart rate's raised, you're not feeling as relaxed, and therefore maybe not opening up as much. So
yeah.
Okay.
There's nobody else in the waiting room kind of wondering what you're doing, who you're seeing. Yeah.
Privacy, I presume, as well.
Yeah, so there's no queues, there's no waiting times, and it's the comfort of your own home. And I do obviously have some clients where home isn't really a safe space. And so they can choose to go to a coffee shop or speak to me whilst they're on a walk. Yeah. So it gives them that flexibility to choose where's good to have a conversation.
And when. And when. People have busy times. So do you think, though, that those factors that you've just mentioned kind of counteract what people would think about the obviously being virtual and not being able to connect as much in the same way? All those other factors actually outweigh
100%. I mean, even for me, I was like, oh no, is it going to be as therapeutic? And you do think about these things, but it 100% is like, we're sitting there on video call, and it's literally as if we're sitting in a clinic room. Yeah,
I presume. And also having that safety, but of just filling in their own space. And also just some people, I presume, with mental health issues, meeting someone new can be a bit nervous as well, and sharing that space. But there's a kind of barrier because it's through the screen. Definitely. That gives them that safety that they can also just switch the computer off if they needed to as well. And then they feel that they don't have that kind of maybe an intrusion, or they're intruding in someone else's space. Yeah. Oh my gosh, amazing. So I never thought of those aspects. Do you feel like you've had to adapt how you approach your therapy sessions because there's online, compared to, say, because before, if you were in hospital, you're dealing with very sick children, probably, as you said, sicker than if they'd had help before. Yeah. If people are choosing online therapy, they're generally not quite as sick.
Generally, yes. I wouldn't see somebody who's in crisis just due to the risk of it being online. But I have a lot of patients who suffer from severe anxiety and depression, a lot of trauma, a lot of grief. So they're still really, really struggling, but they're functional.
Yeah.
So they're able to commit to sitting in a session, which is obviously key. When you start therapy, there is a level of commitment that you have to have on the patient's part. So definitely, I think the fact that they're comfortable and they've made that step to commit, they're able to sort of follow through with it.
It's a slightly different patient cohort as well than I guess you're seeing, which makes me quite satisfying, because if they're committing, they're also willing to do the work to get better as well, which must be lovely to work with.
It is. It's really nice.
What are you seeing a lot of now? Is there a change in the trend of what people are coming to therapy for?
I think so. Generally, there's a lot of anxiety, a lot of depression. I would say trauma from sort of childhood experiences. I think people underestimate how much that really impacts you later on. Which is, I mean, obviously it's hard to sit and be vulnerable and be open and be honest with how you feel or what you might be experiencing, or, and I would say there is sort of there's a change in today's lifestyle. There's a lot of social media influence. So there's a lot of pressure. So I have a lot of patients who have really low self-esteem, really low confidence, they're really insecure, and they want to work on that because they can recognise that it's impacting their relationships or they're self-sabotaging. And do you find with the social media there's also an effect on people's attention spans? Dopamine is reduced, and that can also spiral into other comorbidities like depression and everything else. Are you seeing a lot of that as well, or 100%. Is it just the self-confidence aspect? No, definitely. The addiction, really, the addiction side of social media. It's a crisis, really.
So what would your advice be to those? Because you must be seeing more and more people coming in, and you must be able to wanting to tell the world or people, please, if you could do anything, do less of this or do more of this, so that you don't maybe end up on that appointment with me or through the screen. What advice would you give to people nowadays?
I think we live in such a fast-paced world where things are just everything's so accessible. Life is just not what it used to be. And, as soon as you wake up now, people are scrolling on their phones and they're instantly kind of stressing themselves out, increasing their cortisol levels. And that's what happens when you wake up and go straight on your phone. And you can see all the emails that you need to respond to, and you scroll on TikTok.
My heart rate's going up just whenever you're talking about it.
And we have to be realistic. Some people, you need to kind of get up and do that. But even if you spend the first 10 to 15 minutes not doing that makes such a difference to how you start your day. So if you start it with intention, so just even a bit of a slow morning, maybe having a coffee or just brushing your teeth, stepping outside if you can, just taking 10 to 15 minutes, that's all it takes in the morning without screens. So that includes TV as well as iPads, phone.
Screens are everywhere now.
Screens are everywhere. But if you can just take that 15 minutes to just, let your body wake up naturally. So you've been in a rested state from sleeping, and then you wake up and then you're instantly stressing yourself out. It sets the tone for that day.
I like how simple that is, because we're bombarded with everything, but bombarded with morning advice like you should write a gratitude journal, you should be doing exercise, you should be breathing exercises, maybe go fasting, and then this and that. And just like anything else these days, there's advice that's just so conflicting. But your advice of just 10 to 15 minutes, no screens, and just take it slow. And even if you just did that, things would be better and your mental health would be better for the rest of the day. Generally, I like the simplicity of that as well. So,
and that's how I am as a clinician. I'm very sort of realistic. I mean, if it's not something that I wouldn't do, we're all on our phones. Let's be realistic about it. But 15 minutes is, that's something that's so doable. It's not the first hour.
Yeah.
like, which might be a bit too much for
Yeah.
people. And some people aren't morning people, so that's fine. You can't afford to wake up an hour early.
Definitely. But yeah, there's a lot of people as well, I'm sure, that you're seeing kind of self-diagnosing. You must be seeing that a lot as well. Do you think people should be self-diagnosing? Or do you think it's helpful because they're seeing themselves and maybe therefore some forgiveness? They can forgive themselves a little bit if they are able to put a label to themselves. What are your thoughts on self-diagnosis?
I don't recommend it.
Okay.
It's not something that is useful unless it comes from a medical professional.
Okay.
Sometimes, so this is the thing with sort of labeling, sometimes it's helpful because you can understand and recognise that, oh, actually, maybe I do have this because I'm acting in this way or I'm experiencing these symptoms. So it is helpful in some regards, but also it has to come from a medical professional. A lot of people are Googling. A lot of people are using ChatGPT.
Yep.
And realistically, unless you're willing to sort of commit to some sort of psychological support or treatment, it's just not beneficial. But I am seeing a lot of it. I am seeing a lot of patients coming to me saying, I think I have anxiety. I think I have ADHD. I think I might be on the spectrum. And I'm like, okay, that's fine. And it's that's fine. But when they start to sort of go down the lines of maybe I should do this or maybe I should start this treatment, and it gets a bit confusing and it just adds to the stress.
I definitely agree that if it starts causing people to go down the route of either self-treating or thinking they should be self-treating, then it needs to have that medical input for diagnosis. But I would argue that what I've seen is that there is some benefit for, as I said, self-forgiveness for, I always just thought I was couldn't concentrate or this or that, even if they haven't properly been diagnosed, even if they're not interested in actually getting a treatment plan. Potentially telling themselves, well, maybe it could be this, and actually that's okay.
Yeah.
I would argue that, and I'm not in your field, but I've seen lots of positive stories from self-diagnosis as well. So, but does it cause some challenges when you may be faced with a new patient and they've got their self-diagnosis and maybe you don't agree with it, and it kind of creates some barriers to the help that you can give? Have you ever found that?
Yeah, and I think some people just get really fixated on the label, on the diagnosis, and that just becomes their whole sort of personality. Whereas my job is essentially to educate. Okay, if you do think you maybe have anxiety, let's talk about what is anxiety. How do we treat it? How do we manage it? As opposed to, you're still you as a person. It's important. And I think as long as you don't become overly fixated on it, just trying to find that balance.
So is that a lot of what you do? Is it's mostly talking through how someone feels or their past? Because I don't have huge amounts of experience with therapy. I think there's different types, am I right? And different types of therapy.
Yeah.
Do you mind talking through a little bit what are the general different types and what's unique about what you do, for example?
Yeah, so I specialise in talking therapy, and I'm also trained in CBT, which is cognitive behavioural therapy, which is typically used in anxiety management, depression.
Coping mechanism, is that right?
Coping mechanism, helping you switch from sort of negative thinking to positive thinking, breaking that cycle. I also specialise in addiction psychology.
Loop that back into there somewhere, I'm glad.
Still like to have my addiction somewhere. Grief therapy as well, so loss, whether that's death, whether that's dealing with somebody who's maybe terminally ill, relationship breakdown, and also trauma. There's different types of trauma therapy. There's like EMDR, which is
that
quite
the eye movement one.
Yeah, eye movement desensitization, but it's you have to be specialised in that, which I'm not. So again, I would do an assessment to see what is the level of trauma here, what are we dealing with, and then base treatments around that.
Okay, so talking therapy is actually, I presume, growing in popularity as well, which is that a good thing?
It's a great thing.
Yes.
It's a great thing. I think, so mental health is so it's invisible usually.
Yes.
So it's difficult for people to understand what is going on inside their brain, what is going on internally, because there's nothing to physically see usually. So it's like if you break your foot and you have a cast on, you can physically see you need a bit of support.
Yep.
People are more likely to help you, but mental health, you're dealing with it internally. So getting it out from inside your brain, out when we're speaking about it or writing it down, it's completely different.
Yep. Similarly to the physical kind of illnesses that you talked about, or physical injuries, some people only wait till they are in crisis, which I presume is that physical aspect of mental health. But you're wanting to get more and more people into support, into help with therapy prior to that physical aspect, aren't you?
Yeah, I think it's difficult to make that commitment, and it's a vulnerable time and space for a lot of people. But you do not need to be in crisis to get psychological support. Okay. I want people to think about it like the gym for your mind. So it's not something that you have to have a breakdown for, you have to have severe trauma to explore, or have the worst thing in the world happen to you just to get support. It can be as minor as you think or feel. You don't have to have a diagnosis of depression or anxiety or the common ones that are going around. But I want people to think about it just like the gym for your mind.
Yeah. So you think pretty much most people should have some sort of therapy?
I think everybody should have a therapist. 100%. Yeah.
Okay. Can you tell when you meet someone if they've got a therapist?
Yeah, there's definitely an element that I would be able to tell.
Yeah.
Like if they're quite, emotionally regulated, they're, emotionally intelligent, they're self-aware. Usually those are good signs.
So those are the benefits really of going to therapy, even if you don't have something drastic going on in your life. Can you think of other benefits?
Yeah, I mean, again, people think that therapy it can be quite intense. I think it's the word. It can be quite intense.
Okay.
And I try to normalize it as much as possible, because I think everybody benefits from it. So whether that's just becoming a bit more self-aware, understanding patterns or attachment styles, or why you might be a bit more angry with certain people in your life, or have relationship issues. But I have clients who thrive in all aspects of their life, but when it comes to their relationship, everything crumbles. Yeah. And it's just understanding what is going on and just being so self-aware. So providing as much education as possible is
that's
key.
It, isn't it? It's not just for you. It doesn't benefit just you. It benefits the people around you as well.
Yeah, absolutely.
And speaking of people around you, workplaces. You do a lot of work, talks to people in workplaces about the benefits of mental health. Tell me a bit more about that.
Yeah, so I do a lot of interactive, sort of engaging sessions in corporate places. Usually it's like the real estate world, which is very high pressured, commission only. There's a lot of stress that goes on in the corporate world. And I've started to do sort of stress management, building your emotional resilience. I have one-on-ones with employees just to understand what is going on and how I can support them.
Tell me a bit more about what happens in these sessions, especially not the one-on-one ones, but the group ones.
The group ones, so it's very much just kind of, a lot of people don't know what stress actually is, or what anxiety is, what emotional resilience is. So just sort of giving a brief overview about what these things are, so different topics, and then understanding how to manage it.
Okay. So you want to give us some of those definitions and tips for those who are listening? It'll be really interesting to hear.
So stress is something that we all experience, and we all have. Having stress is a good thing. We actually need it to be able to function. Yeah. But when it gets to the point where we're maybe not functioning, it becomes a bit of an issue. We start to underperform or become a bit more irritable, less engaging. And then that impacts, obviously, how much money you make and how you're performing at work, how you're with your colleagues, how you are with clients. So a lot of these employees are client facing, they're trying to close deals, and there's a lot of times where that just falls through, or they get rejected and subsequently they don't earn any money. So we have clients, like these employees are going months without making money sometimes.
Which will add to the stress.
Which adds to the stress. Financial stress, personal stress, professional stress. And it's hard to sort of compose yourself and still be professional in certain situations. So it's just about understanding and recognising, how do we get to the point where we can just take a breath, not respond. We don't want to react inappropriately because you're still representing a company. Yeah, so there's a lot kind of going on for these employees, and my job is just to ease that stress, provide them with as much support and education and recognition as possible.
And can you give anyone who's listening today some advice who might be going through stress?
Yeah, I mean, even something as simple as breathing. So like I call it box breathing. So inhale for 4 seconds, hold for 4 seconds.
Do it naturally as you say it.
Yeah. Exhale for 4 seconds and hold for 4 seconds. So it's like a box.
Yeah.
So even, and I'm talking like deep, meaningful breaths, not just sort of the breath work that we're doing right now, where whilst we're speaking, it's in through the belly, hold through the lungs and out through the mouth. So by doing the breath work, that even 30 seconds to 60 seconds or 90 seconds, which is really doable at your desk or at home, wherever you may be, doing the deep, meaningful breaths is enough to basically regulate your nervous system by saying, I am actually safe, I'm calm, I can respond appropriately.
And in what situations would you, like what signs is someone maybe going through that they might be experiencing at that moment where they would go, right, this is where I need to start doing this box breathing? What kind of situations are people in when they would benefit from that?
So if you start to feel a bit clammy, or your fast heart rate, or you can feel your sort of blood boiling, if you're starting to get angry, if you, like, people start get very emotional, generally. So say for example you have a client and they've rejected your deal, and you're not going to get paid for that month. That's a stressful situation. However, you're still you're still client facing, you're still in a professional capacity. So if you need to then respond to that client, even taking 60 seconds to do the breath work before responding to them is enough to calm your nervous system, stimulate that vagus nerve, which basically activates the parasympathetic system and will tell you that actually, do you know what? I'm calm, I'm safe, I can respond appropriately. Yep. If you don't take those 60 seconds, you're more likely to respond aggressively or cry or maybe be inappropriate, and then that subsequently will impact you and your reputation.
Yeah. I mean, generally in the workplace, having advice like this must be beneficial to the entire workplace. Do you think mental health is taken seriously enough in workplaces?
I think, especially in the Middle East, obviously, because that is where I'm based, no. There's a huge drive on physical health, huge drive on physical health, but again, physical health and mental health, they go hand in hand. I like to think about mental health as mental fitness. So people exercise to physically feel good and look good, and they feel better, but people neglect their mental fitness. There's still muscles there that need to be exercised. I feel like workplaces, again, because it's invisible, like I'd mentioned before, it's difficult. They focus on deadlines and KPIs, and they focus on the physical things that need to be done. Yeah. Whereas you need to work on your mental capacity to be able to perform.
Because it's something you can track, the physical things easily. Yeah,
exactly. Yeah. And that's why often the mental health gets neglected, I feel, in workplaces.
Yeah. Well, how would you like businesses to, in future, support mental health more within their businesses?
It's about culture. Yeah. It's about company culture. It's about creating a space where people feel comfortable to have a conversation and not be judged, or, just normalizing it, not creating boundaries where it is awkward or uncomfortable. Yeah. I guess it's also useful to have somebody who's a bit of a middleman to have a conversation with, rather than your boss or your senior or your CEO. people start to feel like they're incompetent, or they feel, oh, maybe they'll view me in a certain way if I say I'm struggling mentally. So it's about the language, I think, that we use as well. Mental health, again, people kind of stick to the word mental and they start to think of all sorts of things. And it's just about...
It must be so vast. Sorry, so vast, because we don't say physical health for just generally everything, but mental health. It's people kind of just box it in something that's quite small, but actually it covers quite a lot of things. Doesn't it, as well?
It definitely does. And I think it comes down to leadership in the company. You have to create an environment where people feel comfortable to have these conversations.
I don't think it's just companies. I mean, we both worked in the NHS, and this is just coming from personal experience. It's in there. There's a lot of pressure. There's a lot of negativity, and it's just when we're not able to support our patients, we offload that on our colleagues. And there can be a lot of. It can be draining, and I know that for my experience, I actually had 3 months mental health leave before I left the NHS, and I just left, and there was nothing. It was just literally nothing there at all. So I think it's across the board. It's not just high flying jobs where they're looking at KPIs, and they're looking at everything else. And it was just very grateful to have had a GP who goes, I can see that you're stressed, so I'll support you in that. So having that middle person to give that support makes a big difference to people.
Huge, of course.
But I'm just thinking, if I hadn't had the GP to have that support, I wouldn't have known where to look for support. So obviously having the capacity for an online therapy support is incredible. And what would you say to patients or people who are feeling a bit lost as to where to look for that support?
I mean, online therapy is so accessible. It's something you can do anywhere, anytime, according to you and your schedule. So the accessibility is huge, which is really important in today's society. I think taking a first step of doing anything is really scary, very vulnerable. But again, if you have somebody on the other end, in terms of your clinician, that's comfortable with you, you can easily build a rapport, that is key. That's number one for me, is that you have to be comfortable with them, because you're being sensitive and vulnerable a bit, and you're a stranger at the end of the day. So it does take time to build that, but it's so important that you have that relationship. Otherwise, you're wasting your time, you're wasting money.
And that's in person and or online.
Yeah,
You've got
exactly.
It takes trial and error to find the right therapist for you, I'm sure.
Yeah,
I've done online therapy as well in the past and found it brilliant. I've done in person, all sorts of different things, and I feel like it was really nice to have the opportunity to have flexibility of when I remember even being on holiday and I was on a sun lounger and I was talking to a therapist, and so it is beneficial to have that flexibility as well. I would love to ask you just a few quick fire questions.
Go for it.
So let's see. What is one myth about therapy that you wish would just go away?
I think that, people assume that therapy is about fixing you, but it's not about fixing, it's about understanding.
I like that. Okay. And in understanding, I guess you can fix things that need fixed, but also move forward in the world more calm, more level-headed, and have a better impact on those around you with that understanding. Would that be the case? Yeah,
and it's about having the skills to do so, and these skills that you learn in therapy are lifelong skills that you can use in any aspect of your life, really.
And therefore, I presume the answer to the next question is no, but is therapy only for those in crisis?
No, you do not need to have a breakdown or a major incident or crisis to have therapy.
If someone's looking for an online therapist, are there certain things that they should be looking for to make sure that they'll get that support that they'll need?
Yeah, I mean, so as I mentioned before, being comfortable with your therapist, that's really, really key. So that could just be having a conversation with them over the phone or a video call, just as a sort of check-in. Understanding what they specialise in is really important as well, obviously, so you're getting the benefits of therapy. Again, there's a range of therapists out there, so you have to find the one that suits you based on your needs. Accessibility, we know that if you were to go through sort of the NHS, for example, waiting lists are up to 18 months. For a therapist, it's a really, really long time, whereas online, generally, you can get same day appointments, same week appointments. It's really accessible.
Is there certain standards patients should be looking for when they're looking through online? Probably a vast list of therapists they could choose from. Is there certain key things they should be looking for, apart from the kind of what that person specialises in, before even booking that appointment, to kind of see if they feel comfortable with them? Any key tips to what they should look for when they're looking at that list?
Yeah, I mean, I think always just looking at their background and their educational background is really, really important. I find there's a lot of life coaches now.
Yes, okay, so yeah.
Yeah, and so life coaches are very different to actual therapists. Life coaches generally don't provide therapy. They're not trained in mental health. They're more career focused, hitting goals and objectives in terms of sort of a lifestyle, as opposed to what is going on mentally and providing mental health support. So I feel, especially in Dubai, there is an unbelievable amount of life coaches. And so a lot of people get confused. Okay. What is the difference between a life coach and a therapist? So just understanding who it is you're speaking to, ask what their background is. I get a lot of patients that say to me, can you just tell me a bit more about your educational background? So these things are really, really important to look for. You want to make sure that you're not wasting your time and your money on someone that's not necessarily qualified.
What is your biggest piece of advice for anyone going through anxiety or overwhelm? We talked about the breathing, the box exercise, and I presume we talked about, obviously, seek help is one of those. Was there any other advice you would give to someone going through anxiety or overwhelm?
Honestly, just taking a step back and just recognising that you are maybe struggling or that you are having a bit of anxiety. Just take a step back, breathe, name it. I am feeling anxious, or God, I am having a bit of a bad day. And just allowing that space for it. The more we kind of push away, the more it will creep in. Yeah. So just accepting it.
Yeah. And as you said before, because it isn't something physical, it sometimes takes longer before we can label it. Yeah. But it actually made normalising that mental health issues are present, omnipresent pretty much. Yeah. And that there is help around. Normalising allows people maybe to take that step to actually name things and accept them. Yeah. And that therefore seek help a little bit more easily.
Definitely.
Amazing. What is a small thing that people can do to protect their mental health?
I would say in the morning, if you can, wake up, stretch, have a glass of water, don't touch your phone for the first sort of 15 minutes, unclench your jaw. These are all sort of small signs that you're kind of signaling to the brain that you're actually calm and rested and safe, that you're not in fight or flight mode. And it's a good way to start your day. It's always that's like the best way to start your day. And again, I think we mentioned before that you don't need to sit and journal if you don't want to, or write your gratitude. That you don't have to do these things, but even just sort of unclenching your jaw, stretching, getting the blood flowing. Again, it takes 10-15 minutes first thing in the morning. It's a good way to start the day.
I like that. It's also about centering in on yourself and kind of checking in on yourself, which becomes easier if you understand yourself. Yeah. And you're not trying to fix yourself, you're trying to understand, you're trying to center in, and it'll help you with the rest of your day. That's really good.
Yeah, and you have to signal these things to the brain so the brain knows.
Yeah. And obviously, you've had a vast career already, working in pharmacy and then with addictions, working in different countries, different cultures, and now obviously going from in-person to online. Yeah. What's been your favourite part about working in mental health, or what's been the favourite part of your journey in that?
Oh, I honestly, this sounds really cliche, but I love mental health, and I think it's because every day is different. Yeah. You'll never ever find patients that are the same. Everybody's experiences are different. I've worked in forensics as well, so I've seen some wild things, and it's just been like, I'm living my Netflix fantasy. It's great.
It must be really challenging, obviously, having to deal with so many such a variety of people with mental health issues, and obviously knowing that you're not perfect either.
Yeah.
Does that ever cause a bit of a challenge?
Yeah, definitely. And I think, we're only human, so especially when you work in healthcare, there's an automatic pressure to be a certain way and to have all the answers, but I'm really open, transparent, flexible, so I just try to, if there is something that is a bit of a challenge, then I'll try to sort of do my best, but I'll also signpost if I need to, or get whatever information it is that I need to send over. I do give it 100%, but it is difficult. But the key in mental health, I've worked in mental health for over 10 years now, is you have to be able to compartmentalize.
Because I was going to say, you're taking on board a lot of weight from different people. How do you offload at the end of the day? Or maybe not offload, but how do you make sure you stay well in yourself? That's
actually a question that a lot of my patients, bless them, ask me. And I'm like, first of all, it's my job.
Yeah.
So, and not that it's... that's just the nature of healthcare as well. We like to help people. But I do exercise a lot. I do a lot of Pilates and I go to the gym. I live in a hot country, so I'm lucky enough that I have the weather to kind of go to the beach every single day and just go for a walk and offload that way. But it's so, so important that you're able to compartmentalise in mental health. Otherwise, you would just drown.
What advice would you give to anyone who's thinking of a career in mental health, especially if they can't go to the beach every day?
Yeah, I mean, well, I am from Scotland, so I'm not used to the beach all the time, especially Scottish weather being really, awful.
It is, yep.
But I think mental health is it's so interesting. Yeah. And you're always going to get something that's just different. You experience different people, different cultures, different, instances. It's just it's such an interesting but fulfilling job. And you have to be in it, obviously, for the patients.
Just like anything else, any other career in healthcare, I think you have to be really interested, and you have to want to help people, and be able to compartmentalize. And I think then it can be really rewarding, because
definitely.
you're able to actually help people.
Yeah, I mean, a lot of people in the NHS don't do it for the money, so we have to find somewhere else where we're happy.
Fair enough.
But yeah, it's great, and I would recommend anyone to do it. And I think, again, because you can take the job anywhere. Yeah. So, like globally, you can work in so many different industries. Like you can work, in police custody, forensics, hospitals, communities. There's just so much you can do with it. You're not restricted, which is really great. Yeah.
Thank you so much, Sumiyah, for joining us today and sharing your insights. My biggest takeaway from this episode is that having therapy isn't just about fixing yourself. It's about understanding yourself, which will not only benefit you, but those around you as well. Let's normalize therapy and approach looking after our minds the way we approach looking after our bodies. Whether you're thinking about therapy for yourself or looking to better support your team at work, there's something in this episode for everyone. If you're interested in one-to-one therapy, you can find a therapist at onlinedoctor.co.uk.